My name is Darian Laird, and I am the Executive Director of the Global Coalition for Radiotherapy, and I am very pleased to be invited to share some insights on radiotherapy on the global scale. I'm going to start for you with a map, and it is quite a disappointing map. You can see these dark spots that are essentially deserts where radiotherapy access on a global scale is not available for patients around the world. And a very small quote that you cannot read, so I'll read it to you. It says, "The chance for a cure, the chance to live, should no longer remain an accident of geography." And I know, as was mentioned earlier, Radiotherapy UK is working to provide access in the UK, but this is obviously a global problem, making sure that that patients have the treatment once they are diagnosed. Which is essentially a great opportunity for us to be presenting at this meeting on imaging. That we can work together to bring diagnosis to the rest of the cancer continuum, the treatment as well. I loved what Kay had to say about providing a one-stop shop for patients, and I think that the radiotherapy community shows that and proves that there is an opportunity for this coordinated workforce to come together with patients in mind. And as Anthony mentioned, every part of that workforce is crucial to making sure that treatment is delivered on time and is accessible to the patients in need. I just wanted to share a bit about why there's a need for global collaboration, and this really comes from this idea that, of course, as we saw from the map, access is needed around the world, but there's an opportunity, especially bringing medtech technologies together, imaging and radiotherapy, to provide it in a very innovative way. It's a pleasure for us to be here attending, just because this idea has really been a big part of the conversation from the Global Coalition for Radiotherapy, that if we're able to partner with leading medtech companies, we can bring the workforce together to integrate state-of-the-art diagnosis and radiotherapy solutions. We also are in the age of precision medicine, and this, in terms of accessing the innovation in radiation delivery systems and imaging technologies, we're going to be able to provide better treatment for precise tumor targeting and minimal collateral damage. We also are positioned right now to leverage data and AI for remote treatment, remote planning, and improving our access with this disruptive technology. And finally, it's an opportunity for us to enhance connectivity to streamline workflow and improve patient outcomes across the entire cancer ecosystem. We've been working within the GCR on radiotherapy essential standards. So for the past year, we've brought all pieces of the workforce together, including patient advocacy organizations, Patients at Mind, as well as different medtech organizations around the world, to talk about what is essential for having radiotherapy in your cancer control plans. Because as you saw on that map, radiotherapy is not even mentioned in most cancer control plans around the world. Almost 40 countries do not have access. So this work has been focusing on providing understanding of how we can have quality and safety standards, maintenance and service standards, advocacy, data and monitoring standards, and bringing people together to decide what those are with all of the many resources that are out there, and making it simple and accessible to countries that are starting from ground zero at some point. Through this process, we've actually been approached by the medical imaging community because there are so many similarities, as Joe mentioned, right? That there are similar issues and similar solutions, and we can work together to provide greater access. This is an opportunity for us to build better together, and we love this catchphrase at the Global Coalition for Radiotherapy, because as we're working together, we can improve the lives of patients and the outcomes for those who are needing access to radiotherapy.
Number one, we've got to get cancer up the back at the top of the priorities. In Mike Richards' day, when we had a cancer plan, we had a cancer czar reporting to the Prime Minister. It was number one, okay, from the 1999 Downing Street session. Now it's ambulances, it's A&E. I get all that. I absolutely get all that. But we've got to get cancer back up there. I think the current state of the NHS, it is not suitably managed to actually get radiotherapy when it needs to be. Take, for an example, Carl's very important issue about the tariff. What is that? It's a complete nonsense. You know, if you knew what you would do, you wouldn't do this. And in fact, we talked to the NHS England saying, why aren't you doing this? And now it's devolved down to the ICBs. So they're in charge of radiotherapy. Again, who's in charge? They're in charge of radiotherapy. So we do a freedom of information to the ICBs. Who's your person in charge of radiotherapy? 70% didn't have anybody in charge of radiotherapy. So nobody's in charge of radiotherapy. So that needs to change. So I think it's basically, it's not being managed properly. And why is it not being managed properly? Partly because of the structures of the NHS are not good at medtech and radiotherapy and that sort of thing. And I think they're not listening, really. And so it's our job is to make them listen. We've had really good support from MPs, from the media. You know, Daily Express are running a whole campaign on radiotherapy. Fantastic. But there's so much that needs to get right. And I think we've just not got to stop until it is right with some very clear messaging.
Pat, for anyone who's in the audience who thinks, well, you know, there's Professor Pat Price, she's talking to journalists, she's on the TV, I am just a therapeutic radiographer and I am doing my work every day. How can I make a difference?
You can make a massive difference, you know. Okay, I have to do that sort of stuff. Not that I like it. I remember when I did my first media, but 3 years ago, I remember doing it. I used to say, I'd rather give birth to my children than do live TV. Yes. I kind of a bit better about it now, a bit calmer about it. But it's you know, somebody has to do it. If anybody else wants to do it instead, please, you know, don't absolutely. No, I think everybody's got to play their part. It's, as you said, it's right down from, I'm a therapeutic radiographer. That's the start. Telling people, enthusing people. You know, for recruitment, people don't wake up saying, you know, I want to be a therapeutic radiographer, don't know what one is. So everybody in every way can show what it is and advocate for the subject, from engineering, enthusing about that, all they are. But we've got to get it out of ourselves, you know, because if we talk to each other, yes, all 6,400 of us treating 100,000 patients a year, you know, we need to get it to the next layer out. So I think there's all sorts of things you can do. You know, you can actually sign the Catch Up with Cancer campaign. It's change.org. That's where 650,000 do that. We often have messaging out there. Write to your MP. There's things on the Radiotherapy UK website. Ask Radiotherapy what you can do. Run the miles for radiotherapy. We need more dosh.
Or walk it.
Or walk it, crawl it, you know, lie around, you know, whatever you want to do. Push the pram, whatever you want to do. And I think everybody can do their bit. But I think it's really important that we act together, which is why, because you can see here, it's everything. It's patients, engineers, physicists, radiographers, clinicians, technology, all our industry partners. And that's why in Radiotherapy UK, we want to bring all that together, because we've got to work as a team. The industry task force we've worked, which have been brilliant. You know, it's people and tech. So if we all work together, then we can speak out with one voice and really exemplify it. So anything, even straightforward things, retweeting, social media, all the things we do, you know, get involved. You can all make a difference every single day. You know, all you have to do is say it to one person who might then tell their MP, who might be best friends with the next health secretary, you know, and we can make a real big difference.
If only it was that easy, Pat.
But we keep trying.
We're in the right circles here.
You never know. Yes.
And all of that is really accessible from the Radiotherapy UK website, isn't it? So if anyone wants a template letter to send to their MP,
absolutely
it's really
right.
accessible.
And remember what you two guys do on RadChat is so important. You know, get that out there, get the word out, get everybody saying radiotherapy. I do think we have made progress. You know, people do say radiotherapy now. Liberal Democrat manifesto today, first time ever, mentions the word radiotherapy. Yay! Everybody go out and social media that till the towels come home and just say radiotherapy. Just partly, I must say, very interesting. Talk to the MPs, how do you make an influence? What they say? Go to the media. I thought, that's a very odd way of doing it. Go to the media, they say, we want simple messages. So I think just say radiotherapy is wonderful. That would be a start. Yes.
What makes you so passionate about your advocacy work? Because you do a lot, and obviously just the amount that you've set up is pretty impressive. What drives you? Perhaps
madness. No, I think what drives me is I get quite angry. Actually, and I think it's an outlet for that, because I think as a clinician, you know, I was Marsden trained, I'm an ordinary clinician, and I think you see, number one, you really feel for cancer patients, and because they've got such a difficult time anyway, and you want to help them. And then you see such a fantastic technology, and it's just not being, and what it can do for patients, and what it can even do for the future. It can cure patients, it can make them live great lives. And you just feel that responsibility. And I just get very angry. And also, tech is wonderful. You think how fast we've gone on. You think you can get your mobile phone now and plan somebody in India or something like that. Amazing. And yet 38 countries in the world don't have access to radiotherapy. That is absolutely rubbish. They've got access to mobile phones a lot of the places, so why can't they have access to other technology? So I get angry.
I think one other bit is that patients are avoiding radical treatment because of the delays. So people are actively saying, I'll just go for palliative because I don't want to travel as far to go somewhere else for treatment.
And I think that's about us giving access closer and thinking for the future. Part of the vision is, what should we be in the UK over the next 10 years? There's going to be a 30% increase in cancer cases. So it's coming down the road. They're going to need some radiotherapy. How are we going to do that? Where's that vision to what it's going to be? And people shouldn't not have curative treatment because they live too far away. Something like that, something basic. We should be really helping these people. But we've got to be at the table making those decisions. And because at the moment, I can't see anybody in charge of radiotherapy in the UK.
Do you think you should have that job?
No.
I was just about to say that.
Are you creating a job description?
No. I think, as Katie said, it's got to be a whole team. And I think that is the whole point. But we've got to, I'm quite happy to bang on about it if that's my bit. But it's really got, because it is simple. That's not rocket science. You think how little radiotherapy costs, even if it's £8,000. Well, why haven't we got that? If a new immunotherapy came along with £50,000, what is that? And I think then, of course, the machine manufacturers, they haven't got the money to advertise. You think these big pharma, they've got money in their marketing budgets more than the cost of machines, for goodness sake. Even somebody says, a machine's £2 million. Oh, it's a lot of money. That works out at £400 a patient. That works out at £250,000 every year to treat 700 patients. If you had a drug that was only £250,000 to treat 700 patients, you'd be buying shares in that immediately. This is nonsense. So we must keep saying this all the time and be absolutely clear about it, because it makes so much sense. And I really think the next administration have to really think about this makes sense. I think we are making progress. I think the Department of Health are listening, and we've just got to get a system where radiotherapy can break through and just get on with it.
So, Pat, we always finish our podcast episodes with top tips.
Top tips. Ooh.
So for everyone in the audience, what top tips would you give them to try and help raise the profile of radiotherapy?
Speak about it all the time. Social media about everything you can get hold of. Get in contact with Radiotherapy UK. See what you can do. And actually, join Miles for Radiotherapy. Just get out there and do as much as you can. And in your local hospitals, keep talking about it. Don't accept that you're all very busy in the basement treating patients. No, get there, pushy, keep up to the top table. Make yourself be unpopular if you need to be, but get it there. We've got to fight for our patients, and also we've got to fight for our workforce as well. That's enough top tips.
Perfect. Brilliant. Thank you very much.
And I think I'd say also that one of the most effective political things is writing to MPs. If MPs basically, they've got their SPADs doing and all this, the number of letters they get to the point where they say, right, this is an issue, we have to do something about it. And they always sort of want it to stop, as it were. There's all these things. So it's really effective. As trustees, you could do that as well. Why am I having to raise money for this when the NHS should be doing it? And, mention the word radiotherapy. On the website, there's an easy, you can look up your own MP, just put in the address and it will give your MP. We've got templates that you can, write to them. And I think people should do it. The more they get, the more they will do. Just bombard them. And especially now with election, there'll be new MPs. Get in there first, get throw them. And they'll say, radiotherapy is apparently a big issue. Get in there.
Question here and then here.
I was just going to, if you don't mind if I say something as well, and then Carl has something to add. Just from the global perspective, that is constantly what we're trying to do, is understand how to better speak to government officials, whether it's the Minister of Finance, Minister of Health, to make them know what is radiotherapy, what are the needs of the patients. And I think, as Pat mentioned, it's just having that conversation over and over and over again. Because yes, we can put it on the workforce, we can put it on the patients, but at the end of the day, we just need to educate the people who are going to be the decision makers and bring that money into the centers. This is absolutely the reason that we need groups to come together, like the GCR, working with industry and working with the workforce so that we can advocate for that, because you're right. It is the first people who are at those high decision-making levels will be the first people to be treated. And otherwise, people will say, oh, I don't have the money or the resources to go to the next country over to get radiotherapy treatment, right? I mean, that's a huge disparity that obviously in the UK, I come originally from the US, this is not something that we're seeing there. And that is why it is so important. I mean, the banging on the door and continuing to do that over and over and over again, because there are patients who are never going to get the treatment in those areas. And I think we have an opportunity, like Pat said, we have an opportunity to build together. I mean, it's a great opportunity that radiotherapy and medical imaging were at this conference together to say, no, we want better diagnosis for our patients. We want better access to the treatment for our patients. And we can include all of the surgeons and the pharmaceutical as well to say we want access on all levels, the entire ecosystem of the cancer care for these patients who can't necessarily advocate for themselves.
And I think one thing I've learned is that we now have to make the economic case more. I think COVID did teach us that health is economics. And I think if you have low and middle income countries with even more disparity, that brings all sorts of problems in terms of economy, in terms of migration, all these sorts of things. And I think a lot more, we were at the World Health Assembly the other day, I think there's a lot more thinking about, you've got to make it to the finance ministers that actually saving people's lives with cancer makes them economically viable. This is good for the health of the country. Worse disparity when in lower middle income countries cancer rates are increasing as well. And I know HPV vaccine will be great and everything, but there's patients now. So I think making the case financially as well, but certainly talk to Darian afterwards, come and share your experience with the global. We need people to give us examples and work out there. Thank you.
I think we've got time.